Happy Wednesday, y'all. It is time for a celebration here at blackdoctor.org. My name is Shameika Rhymes. Welcome. Come on in and let me know where you're watching from. Drop that in the comments. Tonight, we're exploring an often misunderstood area of women's health, cosmetic gynecology. And this branch of medicine focuses on enhancing and rejuvenating the love below, providing both aesthetic and functional benefits. So, joining me today is Dr. Michael Reed. He's a leading expert in this field. He's a skilled cosmetic gynecologist with over 22 years of experience in women's health. And he is lots of fun to talk to. I'm going to tell you that. But I want to make sure that you guys also drop your comments in the chat. So, or questions as we go through the show. We'll try to get to those, but also make sure that you share this episode because there might be somebody in your family or your friend circle that might need to see this. So welcome, Dr. Reed.
Oh, Shameika, thank you so much for having me. It's a pleasure and honor to be here and on your platform. I'm looking to have a good time and just share whatever it is that we can share to move the mark for women's sexual health. So again, thanks for having me.
You got to do a dance move because it's a celebration. I'm kidding. You don't have to.
There it is.
We do Soul Train lines here.
All right.
All right. So, because a lot of people have not heard of a cosmetic gynecologist, what exactly is that?
Yeah, it's a great question. So, a cosmetic gynecologist, the word cosmetic is a made up term in a sense. It's a term that's used for women to identify a physician who is a board certified OBGYN who has said, I need to listen and have been listening to women. And there's things that are missing when it comes to our healthcare. And that's an emphasis on women's sexual health. And so, cosmetic gynecologists are physicians who've gone beyond the call of duty, meaning they finished residency, they've opened up their broadband to learn more so that we can answer the questions for the modern day woman. And so it is a term, simply a term, to help women identify those physicians that want to move and change the landscape for women when it comes to their sexual health.
Okay. So, have you seen an increase in women over a certain age that are seeking cosmetic vaginal enhancements or I don't know how many 20-something-year-olds you get walking in the door saying you want to do that, but is there a certain age range that you normally see?
Yeah, the age range can vary. I've operated on women as young as 14 to as old as 88, but it all depends. One of the other things that I think is important to clarify is that a lot of times women feel that because of the word cosmetic, that this is only for Hollywood's A1 listers. It's only for those only fans. It's only for those ladies that like to do streaming stuff. But in
Yeah.
reality, it's really for all women. It's for the soccer moms. It's for the mothers at home. It's for the career woman. Basically, we are doing a lot more than just cosmetic. I mean, there's a lot of functional issues that we're able to address,
Mhm.
and we're addressing these concerns that we don't ordinarily get while in training as a resident.
Can
And
you
that,
mention some of those functional things that someone would want to have cosmetic enhancement or to fix that may not, maybe they've tried everything, physical therapy, everything, and it just isn't working. What are some of
it,
those things?
Yeah, so a lot of times women that have gone to physical therapy or trying different things or have undoubtedly gone to their OBGYN and said, "Hey, is anything okay? Is everything all right?" Because they're not feeling something. Something's not right. They're trying to get something back that they didn't ordinarily or that they didn't have, and now they want it back. And so usually those patients are patients that are seeking vaginal tightening. They want to be able to feel their partner like they once did. They want things to look, have some semblance of how things look before having children. And so they want to improve intimacy. They want to feel that closeness and they want to have an orgasm. And
Mhm.
so we're able to help them do that by uh, increasing friction. Friction is the amount of friction generated correlates to the amount of fun that a woman experiences.
Mhm.
So if we can make the vagina is smaller, that means she'll generate more friction. If she had a larger penis, she would generate more friction. So, different ways to
Right.
more friction, and one of the ways is doing vaginoplasty and improving, you know, women's sexual health and intimacy and fun.
Okay. Well, let's just go through some of these procedures that you do. I told you backstage, I'm gonna let you pronounce them,
Oh,
but
okay.
I'll go with the first one, which I can pronounce this one. Vaginal rejuvenation.
Vaginal rejuvenation. I think the vaginal rejuvenation in general terms just means, hey, I want my vagina to be improved upon, and
Mhm,
it's actually a term that's really convenient for the patient. Because 65% of women and patients don't want to discuss sexual issues, but they do want those issues to be addressed, meaning they don't want to bring it up. And so having a word like vaginal rejuvenation really makes it easy for the patient to say, hey, I got something going on down here. Probe me, ask me some more questions, and
mhm.
that's how we'll get to what's really bothering me.
Okay.
Uh, so, vaginal rejuvenation, I like to think, is a term that allows a patient to be able to say, hey, things are bugging me down here, and
Mhm,
I'm letting you know that. But as a good listener, as a cosmetic gynecologist, hopefully you'll probe and ask questions to bring out what it is that I'm actually trying to improve upon. Now,
mhm.
some of the things that we can improve upon, I mean, we can start from the top to the bottom. Let me just grab this.
Oh, yes, yes, yes. Get that because I was about to ask you to grab it.
So,
Wait, I probably shouldn't have used that word, but and you guys, I
well, I'll
tried to
grab it.
be mature, Dr. Reed. I tried.
I'll grab it. So this is the vulva. This is the what we pay attention to, and this is what we're trying to improve upon. And it's not me; it's the patient. So every patient's improvement is different
Mhm,
because every patient has their own view as to what is pleasing to them. So
mhm,
what can we do? We can start with the clitoral hood. Now, there's a couple conditions, lichen sclerosis and genital urinary syndrome of menopause, where actually the clitoris will fuse over the clitoral glands, not allowing for access to what? The clitoris pink hot button, pleasure. And
yeah.
so, one of the things that we can do is release or unhood the clitoral hood or the prepuce so that the patient can access the clitoral glands and have pleasure. So that's one thing. The other
Okay.
thing we can do is we can streamline it. If some women have very wide clitoral hood and they want it to be a little bit more narrow and streamlined, so it's more of a cosmetic thing.
Mhm,
We can also reduce the labia minora. We can also reduce the labia majora. We call that a labia majoroplasty.
mhm,
We can do non-surgical things to the labia majoroplasty. We can do surgical things. Surgical things are tightening. It's like a facelift to the vulva. So
mhm,
we actually remove some of the skin and then basically we make an incision like on the facelift. We make an incision, remove some skin, and then pull it and make it tighter. We remove some of the skin here and then we pull it and make it tighter. So we can
mhm,
do that. There's also non-invasive things. You can put filler in the labia majora, just like you put filler in your lips.
mhm,
We could put filler here. We can also use radio frequency energy, which can shrink the tissues in the skin and make
mhm,
it tighter. We can change the way the outside of the perineum looks. Sometimes after having babies, things may be a little bit more open. You might see more pink, you might see some bulging. You don't want that. So then
right.
we could do a perineoplasty where we actually close things.
Mhm,
Another one we can do is reverse perineoplasty. I can't get up my husband's penis in my vagina anymore. Things are shrinking. So we can actually make an incision so that we can aesthetically open and allow for access to the
mhm.
vagina. So we could do reverse perineoplasty.
Okay.
We can remove uh, any bulging that we call a rectocele, where sometimes when you push down, you might see a whole bunch of pink come out. So
Mhm,
we can reduce that pink and we can tighten the inside of the vagina, making it tighter and more pleasurable for the woman. So those are some of the things. We can do a lot of other things, but that's a lot right there.
that is. Now, do you we were talking about this backstage. Hold that back up.
All right, here it
Hold
is.
that.
Here it is.
Yeah. So, and I don't know if you can explain because you were explaining to me about the Bartholin's gland so that
Yeah.
people kind of know what that is because, they may not have ever heard of it or know what it is. Can you
Mhm.
explain that?
Yeah.
And
So
do you
Bartholin's
do any surgeries with that?
So Bartholin glands usually enter on the bottom one third of the vagina or the vestibule. The
Mhm.
Bartholin's glands are responsible for providing lots of lubrication on the entry of the vagina. So when you become aroused, you'll see lots of lube and goo there. That's from the Bartholin's glands. However, sometimes that Bartholin's gland ostia or opening can be blocked. If
Mhm.
that blocks, then the fluid accumulates and you can get like a cyst on there called a Bartholin's gland cyst. A lot of times we just drain these in the emergency room. They drain pus and then they heal and it doesn't become a problem. For
Mhm.
other women, though, it may remain. Even though you've drained it, it may come back. And so in those cases, you sometimes remove the Bartholin's gland cyst.
Mhm.
When we remove it, we can sometimes alter the lubrication at the opening. So
Mhm.
there could be a little bit more dryness sometimes at the opening from removing that Bartholin's gland because it's responsible for the goo, right?
Mhm.
So that's the story with the Bartholin's glands. It's very common, treated all the time, and can definitely be a problem for some, but we have a
Mhm.
lot of options to fix it.
Looks like we have a question from Shelly Morris. Where is the pouch of Douglas?
Ah, great question. Pouch of Douglas. So if you think of the vagina in general is about 3 inches, max about 4 inches in length is the vagina. The average penis is 5 to 7 inches. The bigger penises are 8 and above. So how can a vagina accept a 7, 8, 9, 10 inch penis? The pouch of Douglas. It's actually a pouch that elongates and makes more room so that the woman can accommodate different size penises. Pouch of Douglas. There it is.
Okay, so because I've heard you mention that before, and I didn't. I was like, I don't know who Douglas is.
I haven't met him either. He's some old guy, but I haven't met him either. But I know of what his finding was, which is the pouch of Douglas.
Okay.
Yeah.
You mentioned some non-surgical options. Are there any others? You mentioned the fillers, and there was a couple on your website that I can't think of the name of right now. But can you talk
Yeah,
about those?
you could do laser therapy, which is called FemiLift, or Mona Lisa, which is fractional CO2 laser.
Mm,
That works in the vagina, and you can use that to help with urge incontinence, stress incontinence. It can make the tissues of the vagina a little bit more resilient and flexible. So it gives you this feeling that you might be a little bit tighter, maybe 10% tighter,
mhm,
and it can improve lubrication. You can improve moisture. Another option, and that's what we call ablative therapy using fractional CO2, a laser, and the chromophore for the laser. The target for the laser is water. So it shoots and hits water in the body, and that's what
wow.
causes and starts the healing cascade. Now, there's another one called radio frequency, where we're actually using radio waves that come and they hit the tissues and heat up and warm up the tissues. And
Mm,
so that warming up of the tissues starts the healing cascade, and it's non ablative, meaning it doesn't cause any injury because it's warming the tissues. One example of that
okay.
is I like to call it's called
Yes.
Thermiva. It's called Thermiva, and it's really I call it the magic stick because it can do so many things. Um, what it can do, it can increase collagen, elastin, new blood vessel growth. But more important, one
Mhm,
other really neat thing is it can improve small nerve fiber density. So what does
mm,
that mean? So I can use the magic stick around the clitoris, right? Going back and
mhm.
forth around the clitoris and improve blood flow to the clitoris. And I can improve small nerve fiber density to the clitoris. So I can help you become a little bit more sensitive. We
Okay.
can also use the magic stick on the
There you go.
labia majora, on the labia majora. And that can tighten the skin of the labia majora, just going back and forth. We can also use uh, the magic stick on lichen sclerosis because
Mhm.
with lichen sclerosis, the tissues get very thin and paper, cigarette like paper, and this will stimulate collagen and elastin and make tissue stronger and thicker. We can use it inside the vagina on the bottom.
I didn't know you were going to stick it in
Yep,
there.
yep. we can we can use it on the bottom and tighten and improve the tissues. We can also use it on the top. What's on the top is the bladder. So that's where
Mhm.
we help you with urge and stress incontinence. But
Oh.
that's also the anterior vaginal wall where the clitoris is. And so
Mhm.
we would be improving blood flow to the clitoris, improving small nerve fiber density to the clitoris. So that's a non invasive treatment. These are wonderful treatments,
Mhm.
wonderful technologies out there.
Mhm.
You just have to know about them. You got to know
So
about them so that you have choices.
so
Yes.
can patients purchase that, or is it only
No.
you're the
Well, I
only
mean,
one that can operate it?
yeah, it has to be operated by. It can be delegated to like a healthcare paraprofessional. So it
Okay.
could be to a physician's assistant or something along those lines, or a nurse practitioner. But
Okay.
you can't. You have to have a medical license to purchase it. Purchasing is probably somewhere around 50,000, 40 to 50,000
Ooh, ooh. Yeah,
for the machine. So
yeah,
you don't
you
want
got
that at home.
right, right. Exactly. That's a new car right there.
Yeah.
There was you mentioned about like with the bladder and the incontinence and things like that. So does pelvic floor therapy help with those things as well? And do you do anything with the pelvic floor, or are you just strictly from what you showed us? Like, how does
So
that
that's
work?
that's a great question. So yes, pelvic floor. What can we do? I believe in pelvic floor physical therapy, 100%.
I
You have to
co-sign.
do, yeah, you got to do pelvic floor physical therapy. It can make your life, change your life. It's a game
Yes.
changer.
Uh-huh.
Sometimes though, you need to fix the issue before you go to your pelvic floor physical therapist.
Mhm.
That's kind of, the analogy I always give is if you blew out your knee, you wouldn't go, if your knee and your ligaments and
Right.
everything were broken, you wouldn't go to a physical therapist to work on the muscles. You would want to go to a surgeon to fix the knee and then
Mhm.
work on the muscles, right? So
Right.
that's kind of how I work. I work to fix the muscles of the pelvic floor, reapproximate them, and then I want to give them to the pelvic floor physical therapy so that now those Kegels will actually help the patient.
Mhm.
When the muscles are separated and she's having bulging and she's feeling pressure and she's not feeling her partner the way that she would like to. Or
Mhm.
one thing that something happens that a lot of people don't know about, sometimes women will have to splint, meaning put a thumb in their vagina in order to pass a stool through the rectum. And
Wait,
so,
wait, wait, wait.
yeah, yeah.
Yep,
So
show me.
here you go, right?
Okay.
So what I'm talking about, the rectum sits here, right?
Okay.
So if you have a rectocele, when you bear down, that means poo and that kind of thing is trying to come through and come out. So when you're
Oh.
pushing, you see more pink. So if you put your thumb in the vagina, you will then be diverting the poop down
Oh.
and out. And so sometimes when you have that much relaxation in the pelvic floor, you have to splint that pelvic floor so that the stool can come down and out.
Wow, okay. See, I'm going all the way away from my questions, um, because I wanna know what your thoughts are on a poop stool, but we'll come back to that in just a second, so I'm gonna put a pin in that one,
Hmm, hmm.
or put a splint in it.
Okay.
Put a splint in it. I'm immature, I swear. All right, Shelly has another question. She
Okay.
says, "Does frequently using stimulation toys change the natural sensation of the vagina? Meaning, will it become dependent on the toy in order to become stimulated?"
Yeah, I mean, I think that that kind of goes with this vibratory loss that you can get when you're doing long standing procedures that require a lot of vibration. One of the
Mhm.
most common one would be a tattoo artist. If you ever watch a tattoo artist, they are wrapping their instrument, their device, several times to minimize that vibration, because if you have
Mhm.
significant vibration for hours and hours and hours, you can
Mhm.
actually lead to vasoconstriction, which could lead to occlusion of the blood vessel, which leads to poor circulation, right? And
Mhm.
so people are saying, well, if that can happen, it's true. That can happen with those type of jobs
Okay.
and vibration. People are taking that information and then saying, well, if you use your vibrator over and over and over again, it's going to happen to you then. You're not going to vibe on your vibrator as long as you would vibe doing a tattoo artist or
Right.
working on a jackhammer and those kind of things. So, I mean,
Yeah.
as far as being dependent upon it, I I mean, any too much of anything is always a problem, right? And
Hmm.
so uh, I wouldn't, if that's your only way to release is at this point is to self pleasure shoot. I would self pleasure all day, every day if I needed to, right? Your only
Right.
way. But if you have a partner and you guys are getting along and you're loving each other and sharing that intimacy, uh, do it with your partner. Add a little toy too. Do a little
Hmm.
bit of this. Do a little bit. Don't get dependent on one thing. Anytime we get dependent on one thing, it's never that fun and gets a little bit more mundane too.
That's yeah. Mix it up.
You got
See, then
to.
this just brought up another question in my head. But let me
Okay.
go. Well, since we're talking about vibration, let me hit
Sure.
this one first.
Mhm,
So I went through pelvic floor therapy for a good while, but I also had a hysterectomy. So my
mhm,
dealing, and I'm being transparent about the pelvic floor being super tight. So my pelvic floor therapist mentioned getting a pelvic wand. And
mm.
so when the pelvic floor is tight, she says use the wand, the vibration in the wand to loosen it up. So that just reminded me, like, it's not like you're gonna sit there forever
Right.
with the wand. Like, it's just a few
You
minutes, it
got it.
loosens it up, and then you go on. But for people that may not understand what I'm talking about, can you explain it better?
Yeah, so what she's talking about is the wand. The wand is kind of like the magic stick, but it's more of S shaped
Mhm.
so that she can work the inside of her pelvis. Okay. That's what the goal is. Now let's make
Yes.
it so you can understand it. If you go out and you're working, you go out and pull weeds and you're working out in the yard, your back hurts. You usually end
Mhm.
up with two little hard little knots down here in the lower part of your back. And what do you go to? A masseuse or your partner and you say, rub those knots out because my back is killing me. Well, that's exactly what the wand is doing. Just the knots are on the inside of the vagina
Mhm.
and you can't see them, but you definitely can feel them. So you
Mhm.
use that wand to get in there and basically massage the pelvic floor, getting rid of that knot like you have in your back. You feel better when you get rid of that knot in your back. Well, guess what? You're going to feel better when you get that knot out of the pelvic floor. Same thing, same concept.
See, you
Muscle.
explained it so much better. Yeah. Now, circling back to the poop stool, because
Uh-huh.
you were talking about having to use the splint. That's another thing I learned in pelvic floor therapy, using a poop stool, which I just thought was for older people.
Mhm.
Like, but what do you recommend that,
Oh, yeah.
especially with someone that has that you perform surgery on too?
Yeah, I think poop stools are wonderful. They align everything perfectly. You don't have to push as much and as
Mhm.
hard. Uh, if you don't have a poop stool, just flip your trash can over and put your feet on them, and it'll work just as well. But yeah, I think they're amazing. They're wonderful, and if you can do it, do it.
Okay. What does the healing process look like um, for any of these procedures? Is it like a 4 to 6 week thing?
Almost
Is it
all
do you have to stay out of work, or can you go to work?
Almost all of them, as far as sexual pleasure and reintroducing intimacy is gonna be somewhere between 6 and 8 weeks, just
Mhm.
like after having a baby.
Mhm.
As far what was the other part of the question? The first part?
Yeah. Do they? How long does? Well, you answered some of that. How long does it take with that for the healing process? But is this a thing they have to stay out of work? Can they go to
Oh,
work?
so
Yeah.
usually almost everybody can go to work within about a week. And it's
Okay.
all kind of dependent on what we're doing and what you do for work. And so that's one of my questions is, well, what do you
Mhm.
do for work? And, that will help me guide you as to when would be safe for you to go back to work. And it also
Okay.
we just use those things to kind of guide us, what you do, what procedure we're doing. But in general, about a week off of work, week
Now,
to 10 days.
you mentioned 6 to 8 weeks to hold off before testing it out, testing out
Mhm.
the taking it for a spin. What about for those people that they say their partner just can't wait? They can't wait that long. And then they try. We talked about this before, even with having a hysterectomy or fibroid surgery, any surgery, when
Mhm.
they want to just say, like, okay, I'm just going to go ahead and do it because they said they can't wait that long and I don't want them to cheat.
Well,
What?
I mean, with these cosmetic procedures, and depending on who you're going to, if you're going to someone who's highly trained, highly specialized, you're going to be paying a significant amount of money. And I think by paying a significant amount of money, you will follow the post-op instructions.
Okay. You would
Now,
think.
yeah, but now when you're talking about like, you did a hysterectomy and you you're doing it. It's been 3 weeks. And he's, hey, come on, let me just, just a little bit. You could run into issues doing
Yeah.
that. I used to tell my patient, hey, just wait 6 weeks, and then you can have a lifetime of pleasure. Because if you
Mhm.
try to do it a little bit too soon, you can make a hole in the vagina, leading to intestines falling out, leading to more bleeding, leading to reoperation and starting that 6 week clock again.
Mhm.
So hold out for 6 minutes, 6 weeks. Be creative. Hey, check out some other things. What else would you want to introduce into the bedroom and into your intimacy? Maybe you talk about it, chat about it,
Mhm.
watch some videos, be creative. Shit. Figure out
Yeah.
how you're going to get through the 6 weeks, but get through the 6 weeks and then have
Yeah.
a lifetime of fun.
Amen. Um, so on your website, well, first let me say, if you guys have any questions, drop them in the chat, and we'll try to get to those. But how do some of the things I saw on you have like a question and answer section
Hmm.
on your website where a lot of people were asking about nerve pain.
Hmm.
So how common is nerve pain after any of these procedures?
So nerve pain is usually after labiaplasty, is where you
Okay.
end up usually having problems with pain, is after labiaplasty. And that's usually called pudendal neuralgia. The pudendal nerve covers the vulva. And
Hmm.
so when the nerve gets angry, it's upset, doesn't know if it should be firing or should not be firing, we call that neuralgia, angry nerves. So you can have pudendal neuralgia, so the nerve of the vulva, the pudendal, causing you problems. How does this usually happen? The number one that this usually happens is physicians are untrained to do these procedures, but they're allowed to what? Say, hey, I can do them, come on down. I'll do it for a lot less and I'll do
Hmm.
it. But that tells you right there they haven't been trained.
Okay.
That's one of the things that irks me and gets me really upset is that physicians are going out saying they can do something that they have no training in.
Mm-hmm.
So I actually started an institute called the Institute of Restorative and Cosmetic Gynecology, where we train physicians. We've
Hmm.
had physicians come as far as India to be trained on how to do these. We need more docs in the US to take the time and to become a gladiator, to become a cosmetic gynecologist and change the landscape for women. Uh, One doctor can't do it. We can do it together. And I think, not think, I know we can. And that was one of the big reasons why I wanted this institute, so that we can train gladiators on a weekly, monthly basis, whatever it takes. And
Hmm.
each one of us will go out as physicians and change the landscape for the modern day woman. And that's one of my biggest goals. And that's why I started IRCG, and why it makes me so upset that
Hmm.
physicians will do these things having no training in these things at all and
Hmm.
misrepresent uh, cosmetic gynecologists. Upsetting.
Nope. Yeah. And I want to piggyback on that because that's one of the things that I always, always am very passionate about is you have to advocate for yourself and do your own research and find, read reviews of these
Yeah,
doctors. Like
yeah.
I think that's a huge thing. Um, and I forgot to ask you about one procedure
Mm.
for the fupa.
Ah.
you know,
So now,
you got to tell us how to fix these fupas.
yeah, yeah, you could do liposuction to the fupa, or you can
Okay.
actually remove the fupa, which is the mons pubis, a little bit of extra fat down low, sitting right on your mons pubis, your little fupa. We can take care of that. There's also another really cool procedure called the vagi-angelo. Basically, it's restoring the angle to the vagina
Mhm.
without having to go through full length tightening. It's more of a tool. It's not treating a function really,
Mhm.
but it's to improve friction and direct the penis towards the anterior vaginal wall. And Dr. Amir Marashi came up with this idea, and it's been a great one. And it's another great tool for women to improve sexual gratification. It's fairly new. Vagi Angelo should have people check it out. It's really great.
How long do these surgery results last? Do people find they have to come back like in 10 years and do it again, or does it last forever?
That has to do one on a few things. One, it depends on your surgeon. Surgeon
Mhm.
trained, did they do the right procedure, and did they
Mhm.
do it correctly? Let's
Right.
assume that they're trained, they did the right procedure, and they were trained appropriately. It should last you a lifetime. One of the things that I do and I encourage others to do is I give my patients pelvic floor physical therapy in their hand. I give them a PeriFit device. And then that allows them to do exercises, working the pelvic floor, doing Kegels in their home while
Mhm.
at the same time receiving biofeedback. And that's
Oh.
just amazing. So if you do those exercises, stay on top of it, it should last you a lifetime. The only thing
Mhm.
that we can't fight is gravity and age.
Mhm.
They end up winning at some point.
Shelly's full of questions tonight.
All
What
right.
products will help with? I was getting ready to ask this too, but what products will help with dry vagina? But let's back this up and explain about the vaginal dryness first and who experiences that, and then go into the products that might help.
Okay. So vaginal dryness can usually comes one. It can be one of the first signs in perimenopause that you will experience, that women may experience, is lack of lubrication to the desired amount when they're aroused. And so, initially when you're having issues with vaginal dryness, there's lubricants, and moisturizers. Lubricants are used at the time of intercourse. So they're there to make intercourse easier and more fun and slippery and wet. Moisturizers, on the other hand, are used on a daily basis. This is to prevent that chronic dry feeling when you're walking and you're sitting and you're moving and you're like, my goodness, I'm dry. I can't stand this. That's what a moisturizer is for.
Okay.
Now, if you're experiencing these things, you can also develop what we call genital urinary syndrome of menopause, so that, which can cause problems with your genitals. It can cause problems with your urinary tract system, and it cause problems with the vagina. So you can see labial resorption, where the labia kind of get smaller and disappear. You can see clitoral hood fusing. You could see worsening vaginal draining and begin to start to split on the backside after having intercourse.
Oh goodness.
So a lot of things can happen if you
Yeah.
just ignore it. So moisturizer and lubricants are first. After that, you can use several other options. One is vaginal estradiol. You can use that on just about anyone, and it's
Hmm.
safe. And when I say anyone, I'm saying even women that have had breast cancer can use vaginal estradiol, and
Hmm.
it will slowly over time increase collagen, elastin, and new blood vessel growth, and it
Okay.
will help. And it's something that you would do for a lifetime, just like you brush your teeth every day and wash your face. Well, you give estrogen to your vagina and keep her happy. And you
Hmm.
do that 2 to 3 times a week, and it becomes a lifestyle in order to have that. Um, another treatment is
I
CO2
thought you were
lift
about to pull out
V.
the magic stick again.
No, CO2 lift V. It's called carboxy therapy. And basically, you're using CO2, carbon dioxide,
Hmm.
in a gel that stimulates increased oxygen, new blood vessel growth, and collagen and elastin very rapidly. I mean, in days, quickly
Hmm.
changing the whole environment and microbiome. We could use laser, like we talked about earlier. We could
Right.
use the magic stick like we talked about earlier.
I'm
That's at
sorry, I have
least
a song
five,
in my
six
head.
things.
The
I know you
magic
do.
stick.
Thanks, 50 Cent.
Yeah, you see? Thank you. You knew. Celebration over here.
Yeah. Yeah,
Sorry.
so I think that's a lot of options right there, and then you can
Mhm.
use, platelet-rich plasma too. You can use
Oh,
PRP, and you can
okay.
inject into the clitoris and the G zone, which we
Mhm.
call the O shot, and that will improve your ability to orgasm, both with self-pleasuring and the stroke of a penis, finger, or toy. It will
Mhm.
also help with lubrication, and it can also potentially help with urge and stress incontinence. So that's a
Okay.
lot more options than what we had just a few years ago.
Yeah, you also, while we're talking about even with the estradiol, you also help with those menopause symptoms as well. So, like, what would you for women that maybe their testosterone's low or their progesterone is low, like what would you advise them to do if they're having night sweats or they can't sleep or vaginal, well, we went over vaginal dryness, but the dry skin, the hot flashes, Lord,
Yeah, yeah.
yeah, I could go on and on.
Right. So you got to find a good provider. You can go to menopause. Um, society.org.
Mhm.
It's our North American Menopausal Society, now
Okay.
changed to the Menopause Society.
Mhm.
And it's a organization that really helps physicians stay on top of caring for women and being a menopausal practitioner.
Yeah.
I am one. And so things that women can run into with changes in their hormones are, like you said, hot flashes and
Mhm.
uh, vaginal dryness and mental fog and mental acuity, anxiety, new onset joint pain. All of these can happen
Mhm.
with the loss of estrogen and progesterone. Now,
Mhm.
here's the big issue is that there was the WHI study that was done about 20 years ago that destroyed a cohort of women, which basically preached that estrogen causes breast cancer. And we should have really changed the way that we brought that news out and said there's some new information that we learned, and as it stands we're going to do a little bit more studying, but
Mhm.
we suggesting that as of right now that we only do estrogen because
Mhm.
they actually continue only the estrogen arm in that study where they looked at estrogen and progesterone and its risk, and they
Right.
found that women had more heart attacks and all these other things, which I could explain, which is like another lecture. But uh, they continue just the estrogen only arm of this study
Mhm.
and can completely say unequivocally that estrogen doesn't cause cancer. And so that's the thing now, is to understand that estrogen doesn't cause cancer. The other thing is to understand is the window of opportunity. When is it that you can start estrogen or hormone replacement? It's about,
Mhm.
the window is 10 years, within 10 years of your menopausal status. So if you went into menopause at 47, no period for a year, then you have until 57 to start hormones safely
Okay.
without having all the other detrimental effects that could have potentially happened. So we've learned that it's the window in which we
Mhm.
start, not the fact that you're on it, nor the fact that you stay on it. So we don't
Mhm.
have any problems with you staying on it into perpetuity, but nobody
Yeah.
lives into perpetuity. Everybody dies, but
Right.
with no problems with it. It's all
Okay.
about the window. Yeah.
That's helpful because I've never heard that before. So thank you for explaining that. And you guys, we only have a few more minutes, so make sure you get those questions in. And because it's Fibroid Awareness Month, July
Mhm.
is Fibroid Awareness Month. Dr. Reed, you have one of the best explanations on what I have ever heard of what fibroids actually are. Can you explain that to and let everybody
Well, you
know?
putting pressure on me, like
I know, but you can do it. I trust
so
you.
so 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 fibroids are benign muscle cell tumor. It affects all women. It tends to be more aggressive and larger in African American women. We know it's benign. Basically, cells aren't following some basic rules. So as cells grow and they're growing, once they touch each other, they should stop. It's called contact inhibition. So once they hit each other, they should say, "Oh, we're done growing." But in this case, you lose contact inhibition. So the cells just grow on top of each other and grow and grow and grow. And then you end up with a tumor. And remember, these were all benign cells to begin with, but they weren't following the rules. They wouldn't stop when they
Mhm.
touched each other. And so you develop these tumors. And
Mhm.
they're all benign, but they can cause some problems for sure. They can
Mhm.
problems with heavy bleeding. They can cause problems of pressure. They can cause backache. They can cause pain with intercourse, heavy vaginal bleeding, breech presentation. It could lead to miscarriages if they're in the wrong spot, meaning in
Mhm.
the submucosa within inside the uterine cavity. Can
Yeah.
cause problems with, recurrent pregnancy loss. So
Mhm.
fibroids aren't something that you should ignore. You should get some education on.
Mhm.
And then just because you have fibroids, you don't have to have a hysterectomy either. There's other options out there.
Mhm.
There's uterine artery embolization that you could try. There's also endometrial ablations. Like if you're having heavy bleeding, you can do an
Yeah.
endometrial ablation and burn just the lining of the womb so that you don't bleed as heavy.
Mhm.
If you're still in the reproductive age, you can go in and try to pluck out those fibroids that are causing you problems and still retain the ability to carry life and bring life into
Mhm.
this world. So there's a lot of different options. It's really about, when it comes to those fibroids, one, you want to find a physician who is confident, trustworthy, and is listening to you and competent. And also you want them to be a good surgeon, because if you guys decide together to remove the fibroids, you want them to do a really good job, or you
Yes.
want her to do a really good job. You'd
Hmm.
also like her to be flexible, meaning having some connections to maybe some interventional radiologists that she really likes and gets along with, because
Hmm.
that means they've developed a relationship. That means that most likely that doctor who's doing the uterine artery embolization that she is partnered with is probably pretty savvy in it and probably pretty
Hmm.
good at it. So those are the things that I think you should look at and take into consideration, and just don't go with uh, the first doc and what that doc says. The other thing that people often forget when they go to a physician is their gut, right? When you walking at night and you go and look down an alleyway, your gut said, I ain't going down that hallway. Well, you can do the same thing when you
Yeah.
go visit a physician, and you
Hmm.
listen, you take in your information. You, of course, have some questions. You've done some research, and they answer some questions you like. You don't say, "Okay, I'll do it." You say, I ain't going down that hallway. I'll go find me somebody else." And that's what you have to do
Yeah.
sometimes. And that's
Yeah.
okay. And that's okay. And
I
that
like
is
that.
okay. Hmm.
Where were
Yeah.
you when I had surgery 10 years ago?
I was in
And I should have
Nebraska.
said,
Yeah, yeah.
Oh, let's see. We've got a question from Kanisha. She says, if I've had a partial hysterectomy, sans ovaries, does that lengthen my window of time to get to menopause? I don't want to dry out. Girl.
I think that's really a great question, because one, she's had a hysterectomy, so she doesn't
Hmm.
have the normal cues to let her know that,
Yeah.
hey, something's changing. Periods aren't changing or disappearing or becoming lighter. The other thing is that she's had a hysterectomy, but they didn't remove her ovaries, which was cool, really cool,
Hmm.
because sometimes when you remove the ovaries along with that hysterectomy, they can just drop right into menopause, and it can be horrible, horrendously
Yeah.
horrible for the patient. And
Hmm.
so just knowing that ahead of time is important. But anyway, getting back to her question with her ovaries and menopause, I mean, the average age of menopause is 51. So
Hmm.
what I would do is depending on her age and when she had the surgery. So let's assume she had surgery like at 46 or 44, and
Okay.
she's coming to me at 52. That's 8 years since she had the hysterectomy. But she was 44, so she didn't start having hot flashes till a year ago. So she probably didn't reach menopause but a year and a half, 2 years ago. So she would
Hmm.
be a great one to start on. Just because we have that window opportunity of 10 years, you also want a physician who's savvy, right? So that
Right.
we can look, even though the rule says 10 years, 10 years is a guideline, right?
Hmm.
Guideline. We're allowed to operate outside of guidelines. That's what they are,
Yeah.
guide. And so if I have a patient who is 62, she's 12 years from menopause, she exercises, she works out, she
Hmm.
doesn't have any comorbidities, she's doing well, she can't stand it, she wants to start on hormones, I would have the discussion with her, and she would be an ideal patient to start on, no problem, right? But if I have a patient that's greater than 10 years and they're a couch potato and they have high blood pressure and diabetes, I'm going to say, yo, no, 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 no. We're going to treat the vagina and keep that vagina happy, but we can't
Right.
do the hormones, right?
Okay.
And it made me think that I didn't answer a question of yours, which was, well, when do you put someone on testosterone? When do
Oh,
you do
that's right. Yes.
progesterone and that kind of thing? And progesterone is important for those women who have a uterus,
Hmm.
because when you're taking hormone replacement or estrogen replacement therapy, you need progesterone to protect the uterus so that you don't develop a cancer from the uninhibited estrogen. So it doesn't cause breast cancer, but it
Hmm.
can cause an estrogen dependent uterine cancer, cancer in your womb. And so that can easily be mitigated by you taking progesterone every day. The
Hmm.
other thing that the progesterone would do was help you to fall asleep.
Yes.
And so you could take that about a half hour, 45 sleep minutes before you go to sleep. Now, the testosterone usually comes in, and the patients are usually probably premenopausal,
Hmm.
because our testosterone levels go down in our mid to late 20s. And testosterone is responsible for our bravado or libido, like,
Hmm.
let me get it, And so if that's low, then you're not wanting it. You're not thinking about it. You're not having
Right.
sexual thoughts. So when that guy walks by, you don't even bother to look. You just keep doing what you're doing.
Right.
So testosterone is a place that can help with that and
Hmm.
improve your libido and get the thought of intimacy on your mind a little bit more frequently, and it can help you build muscle and create energy and confidence. So
Hmm.
I love that one, and it's also extremely safe, long as you are working with someone who's checking your levels and asking you questions, because there are some things your clitoris can get bigger, your voice can deepen, you can get acne, you can lose hair, but those are the cases where a doc is just giving you something, not explaining anything, giving it to you and saying, "Okay, see you later. Give me 300. Bye." That's not how it works.
Right. Yeah. Yeah. Ooh, I think I told you before about my experience with testosterone. Yeah. We'll talk about that later again. I was the Incredible Hulk.
You probably were getting too much. Getting too
Probably.
much.
Probably. So, for my last question, and I ask everybody this: what feeds your soul, Dr. Reed?
What feeds my soul?
Hmm.
As of well, what feeds my soul are my children. I got 6 of
Hmm.
them, and um, being with them and having time to spend with them and spending these whatever years I got left with them. I try
Yeah.
to cherish that as much as I can. Another thing on top of that that really has been real inspirational to me and really has been really invigorating in my life is learning all these different things, sharing all these different uh, treatment options for women, and
Hmm.
then training doctors, and that hopefully one day someone will say, Dr. Reed made a difference for us
Hmm.
and women, and that's what pushes me on, and that's what feeds my soul and makes me
Yeah.
excited every day.
I love it. I want to thank you for joining me on Celebration. You don't have to come back because I still had like 50 other questions for you. That gives
I,
you a great reason to come back.
it does. And I'm really, just really appreciative of you letting me come on and speak and share. It's making a difference. And thank you. Thank you, Shameika. Thank you.
You are so welcome. I wanted you to bust out in a dance move, but first let me do my outro. There you go. There you go.
I'll get the
But from,
wave for you.
yeah, oh wait.
Break dancing was in my time. I could break dance. I could never do the windmill, but I could do the robot and pop and do the check. I could do all it. I don't do. Could never break dance. Couldn't do the windmill, but
That is hilarious.
fun.
Well, for more information on reproductive health, everybody head to blackdoctor.org and check out all the articles over there. And as for me, I will see you guys next Wednesday for a celebration. I'm hoping the topic is about healing trauma, but we'll see. Don't hold
All
me to
right.
that. We'll see. Everybody have a soul filled rest of the week. Until next time. See you later.
Thanks.